So welcome everyone. This is to really give you a very warm welcome to wherever you are in the world to the second WHO EPI-WIN webinar of the Science Communication series. My name is Ramona Ludov. I'm a technical officer for evidence-informed policies at the Global Infectious Hazards Preparedness Department at WHO in Geneva. And I'm very glad to introduce you to our speakers today from Mercy Corps. So this time we will hear about an innovative science communication concept from Mercy Corps describing their community-led approach to improve COVID-19 behaviors and vaccine confidence. The webinar will feature country examples from Puerto Rico, Haiti, Iraq, and Nigeria to showcase how assessment, social media listening, and community feedback can translate into an evidence-based pandemic response. And so we're very, very excited to welcome with us today Nicole Grable, Vimaris Rivera, Jude Jonatas, Mohamed Ismail, and Grace Oguntande as our speakers representing Mercy Corps. But I'd like to mention that there are also other team members on this webinar who will be able to answer your questions. We will start with an introductory presentation by Nicole that will then be followed by the different country case examples. And at the end, we have about 15 to 20 minutes for discussion. So please feel free to submit your questions through the Q&A function via Zoom, and I will then collect them and read them out to the speakers so that we get more information based on what you're interested in. And with this, a warm welcome to our speakers today, and over to you, Nicole.
Thank you, Ramona. At this time, I'll share my screen and put my presentation into present mode. I would like to welcome everyone today on behalf of Mercy Corps and welcome my colleagues from around the world. What we're going to share with you today is how we've taken this community-led approach to learn from communities and how we can respond to their needs related to COVID-19 prevention behaviors, as well as different vaccine confidence strategies. At Mercy Corps, we've had an overarching approach, and you'll see how it presents in different ways across the different regions around the world. So on that note, I would like to just briefly introduce my colleagues. We'll be hearing from Vimaris, Jude, Grace, and Mohammed. As Ramona mentioned, we have other colleagues with us today, and I would just ask them to please put a note in the chat introducing yourselves. And so for the people listening and respondents here, please feel free to have a dialogue and discussion, and some of our colleagues on the line who can help answer some of those questions as we go. So on that note, I would like to hand over to Vimaris to talk about the Puerto Rico program. We call it the Rumor Tracker program, and she's going to tell you a lot more about it in more detail. So Vimaris, over to you.
Thank you, Nicole. Hi, everyone. Thank you so much for being here with us. My name is Vimaris Rivera, and I am the program manager of Mercy Corps Puerto Rico. I've been supporting the implementation of community-led risk communication and community engagement programs, and I will be speaking to you a little bit more about our implemented programs. But just to let you know, Mercy Corps Puerto Rico has been working hand in hand with local partners and communities since October 2017. And we quickly pivoted our programming in response to the first cases of COVID-19 and have been working ever since to leverage our community engagement campaigns, Cuídate, Cuídame, and Por la Vida, which are COVID-19 information programs. We have also leveraged partnerships and networks to get accurate and timely information and resources to the most vulnerable communities that we serve. We began addressing questions and concerns about vaccines in December 2020 through some Facebook live streams where we brought together journalists and influencers and medical practitioners who could answer questions in real time. But we quickly did an assessment after our Cuídate, Cuídame campaign, and we found that communities still lacked access to credible and reliable information. And there was an ongoing need for more direct education and support to communities, including easy to communicate vaccine information, given the very complex terminology that was being used by the Department of Health and other organizations. We implemented a rumor tracker and evidence-based information campaign in Puerto Rico. If we can move to the next slide. In collaboration with trusted local partners, and through this program, we work to increase vaccine acceptance and trust within communities in Puerto Rico. For the Rumor Tracker program that Nicole mentioned, we leverage the partnership we have with 17 resilience hubs, which are community-based organizations on the island, and relationships with collaborators such as Puerto Rico Public Health Trust, Ciencia Puerto Rico, and Ciencia en Tus Manos, which are science-based and health-based organizations, to develop and to identify community leaders and community health promoters who could help us understand that information that was circulating in communities to develop a weekly evidence-based response. And our program has an island-wide reach, including island communities and remote communities. And in partnership with our collaborators, we reached remote and other very difficult areas, especially in island municipalities. And in my next slide, I'm going to just show you a little bit the big picture of the program, program design and methods. It took us almost about 2 months to prepare and design. A variety of partners were included in the design and in the methods, and contributions were very meaningful to reach the communities that we were planning to serve. We trained community members on how to identify false information and narratives. We also tracked the abundance of rumors and questions that were circulating about vaccines and COVID in general, to develop an approach to monitor and response, where we created content and then we circulated back to the community leaders and the community members. Into my next slide, we also had other activities that were going on and partner leverage events. All collaborators shared the same content, and this really made it a more comprehensive and community approach. In my next slide, I will pass to Nicole so that she can share a little bit about the collection and the review of the data that we did in the Rumor Tracker program. Nicole?
Thanks, Vimaris. So to create the content, we went through a very systematic process to monitor what was being said in social media. We did that on a regular basis in collaboration with Internews, and so collecting information on a very regular basis, multiple times a week, with the goal of doing it daily. We also collected on a weekly basis information direct from the community leaders and the health promoters. We wanted to know what information they were hearing on a regular basis and what information they felt like was most risky, or what key questions they were hearing that they needed a response in real time. Each week, we analyzed that information in an Excel format. We combined both the social media information as well as the community feedback into one Excel file so that we could code the data and understand what were the most common topics and the most risky topics. So each week, we had a report produced that would highlight the top 5 either risky or most common rumors or questions coming out. And then we would come together collectively as a team to determine which information we felt like we needed to respond to at that time. So organizing the information helped us get from a place of uncertainty of all of this information into how do we respond? What information can we fill as trusted sources, whether it be information voids or addressing misinformation or providing a response as fast as possible for any news that might come out about any specific vaccines? How do we leverage our channels and our reach to respond to information that was most needed? From there, we went in to design an information action plan, and I'll give a shout out to Darlene, who I think has joined us, who really spearheaded this part of the process. We identified what was the most risky part of the information, and then we would design it based on risk category to what type of response. Was it going to be some type of need for a myth busting, or was it more of an educational piece, or how do we systematically address the issues? We created a draft of the content, and then all of the collaborating partners would come together and do a review for both cultural sensitivity as well as technical accuracy related to vaccines or other types of information. So back to you, Vimaris, to just mention a little bit about the topics that we created.
Yes, Thank you, Nicole. And based on the analysis that these were the topics that were decided to cover in order of weeks that were created, a total of 10 posts were created and developed. And basically rumors about death and vaccine hesitancy or vaccine efficacy were among the most common rumors. And we decided to tell a more comprehensive story. We decided to provide an educative or maybe a storytelling approach in order for people to really understand how vaccines were created and developed, understand the science, the terminology that's being used, and what are the risks of COVID versus the vaccine. In my next slide, you can see you can see what a video or post looks like in more detail. You know, it's really simple, no jargon was used, and very easy to understand language and design that was shared through our different platforms. And my next slide, now that I'm talking about how we shared it in the platforms, when we created the content from the leader, we channeled the content through a WhatsApp group that we created with the leaders. And the different formats of the posts that were created could be easily shared on social media, or could be utilized by community leaders and community health promoters to use in one-on-one conversations with community members. Also, partners shared the content on their platforms, and thus people were from the communities were getting the same information that addresses misinformation in a clear and a very concise manner. And that's basically how we were circulating the content. If you have any questions on how to share the content via different platforms, I'd be happy to talk more in the discussion session. But I just wanted to also mention that to date, our program reached over 118 participants to do the activities, to the following activities. We did trainings to community leaders in identifying rumors and misinformation. We did educational materials shared in social media, including videos, posts, and also infographics. We did 2 articles and news, local newspapers, and we also did an infodemic and management training to journalists, journalism students, and media professionals. We also conducted an assessment in June to better understand the impact on community leaders' knowledge, attitude, and behaviors, and how the information supported their initiatives to improve vaccine confidence in their communities and their personal groups that they supported. And 100% of those community leaders confirmed that they were able to identify misinformation, and they felt that they had the relevant information and skills that they needed to answer the questions about COVID-19 and COVID vaccines in general. So thank you so much for your time. I will pass it on to Jude from Mercy Corps Haiti team to discuss the community-led projects they have been implementing.
Thank you very much. Hello, everyone. I'm Jude Jonatas. I'm the program manager for Mercy Corps in Haiti, and I've been with Mercy Corps for 7 years now. And I have this opportunity to lead a program that addresses the COVID-19 pandemic in Haiti. Our program was carried out in 2 localities. I have to say Canaran in the capital, and Cap-Haïtien, the second city in Haiti. And there's 2 communities are really community vulnerable people, and we have a lack of information, especially for the COVID-19. People don't really believe in this pandemic. People are really reluctant for the vaccination. It's why we opt for an approach in the community, inside the community, and we bring together a lot of community leaders, some influential. I talk about religious leaders, or youthful leaders, farmers, entrepreneurs, and in each locality we have 100 community leaders in our processes. So it was a very, very big mobilization to take those leaders in our program, because even those leaders didn't believe in the pandemic before. So our process, we can move on the next slide, please. Our process was like, this is an overview in our process. And it was really important for us to know what we will talk about COVID-19 in the community. It's why we make a preparation. This preparation, we have to develop an assessment. This assessment prepares us to know better what the community wants in terms of information, what they would like to know. And after that, we come with a team. We come with a team to know exactly what kind of people we need in our team to address all the issues we see in the assessment. And after that, we have our workshop. This workshop was very, very, very important for us. And again, thanks to Lincoln for her support for the workshop. And we have also a hotline with our partner Viamo that take the technology part. And we have a lot of messages, we have a lot of sensibilization, but we did it in the telephone, and we sent some messages to the community. But it was also important to go in the community to make our workshop, because in Haiti, even you share the messages to the technology, but some people, especially in this community, need to be in front of you to talk, to ask questions, to be confident they can share the truth, they can talk to you, and after that you can say, okay, there's part of the community know exactly what we would like to say in terms of the COVID-19. Next slide, please. And we make it in the community lead human-centered design process. Everything was by the community. Everything was done by the community. We come with the process, but they come and they share, they set their goal, their own goals. When we finish the assessment finding, they came, each sector, we put all the sector, each sector come and they can set their goal for this pandemic. And we have our empathy map and journey process. The journey process, it's like they give us exactly what they would like to see from Mercy Corps. They can help, they can support them to do this activity in the community, because they are the influencer, they are the leader on the community. Now they understand better what is the COVID-19, what is the vaccine. Now they want the support from Mercy Corps, and they can go in the community, they make the replication with our support. And we make also a framework, the framework from every sector also, to come in the community, and they know exactly the framework, what we can do in the community for the COVID-19, for the vaccination. And after that, we have our messages, and each sector, each leader know exactly the role they will play in the community. They know exactly what they will do in the community, because they organize everything. They have the good information now. They know exactly what support they need, and they can go in the community. Each sector know their role, each leader know exactly the role they will have in their community. Next slide. And for that, we talk about many things. And the infodemic, in Haiti, we have a lack in information, especially for the COVID-19 and the vaccination, and people have a lot bad information. So we have 5 modules we talk about. We analyze the rumors, we give the good information. And we have another module about the COVID-19. What is the COVID-19 is. We talk also about the communication. When they go in the community, they know exactly what kind of posture, what kind of skill they have to talk to the people. And we talk also about the COVID-19, the vaccine. When we make this workshop, we didn't have vaccine in Haiti. We didn't have vaccinated. So we have a lot of questions, a lot of information, and we miss also, we didn't have all information about the COVID-19, but people know exactly what channels they can have to know exactly what is the good information. And we talk also about the communication skill during a public emergency. And after that, the leaders, the influencers, we go in the community to make this activity. Next slide. After that, we developed a strategy plan. It's a risk communication community engagement. They take their engagement to do something. And we have a strategy for each sector. And in this slide, I can see some religious leaders, women leaders, everyone has a strategy plan. And everything you see in this slide, it was done by the community leaders, and they have their plan to go in the community and make the job. Next. Yeah, and to do that, to make this strategy, we ask a lot of questions before we target our target audience. Who do you feel to highest risk to protect in your community? Who do you feel are the most vulnerable people? What are the key messages do you think we will need in the communication? And we had a lot of questions to address all the issue, all the uncertainty we have in the community. And after that, we had a lot of questions response, because now the community leaders know exactly what is everything about the COVID-19. And we have a testimony, for example, for a Canada participant. Now we know what coronavirus is, and I look at all of this post-it, and the work is amazing, because we see everything in this session we made with this community leaders. And we can skip next slide. And after that, we have the strategy plan. We know exactly the vaccine message we want to develop. Even in our platform, Viamo, last week, we make this update for the vaccine message. As I told you, we didn't have vaccine in Haiti when we make this workshop. Prepare, we know exactly what kind of information people want for the vaccination. We have a lot of questions in this workshop, and we can prepare better to know exactly what kind of messaging we have to develop. Even for the community leaders, we have a 2-pager summary for the vaccine. We talk about AstraZeneca, Johnson & Johnson, Moderna, Pfizer. Now they know exactly some good information about the vaccination. They can go in the community and talk about the vaccine, and they have more confidence, or they have confidence now, because before the training, we see a lot of uncertainty, a lot of worries from the community leaders. They didn't believe. And after that, they know they have this information. We develop a messaging about vaccine from a 2-pager summary, and now they have material, they have skill to go in the community to talk about the vaccine. For the last slide, and I would like to say, you can go in this next slide, please.
I think this is the last slide.
Okay, so yeah, what I would like to say, it's about the process. This process was very, very new for us in Mexico, Haiti. Even the participants, even me, even other colleagues didn't see where we are going in the process, okay? One thing, it's really important, it was the process. We start, we have a lot of positive, we don't really know, we don't see the final result. And after the workshop, we see everything, all we done in the training. And even for the participants, they were very, very happy, enthusiastic to see everything they did in terms of journey to know what is the COVID-19, what is the vaccination, and all the information they have now to go in the community. And in terms of preparation, in terms of practice, it's really important to prepare this type of workshop, because when you come in the training, people don't really have confidence. We have to prepare everything, make practice, and after that, we can say we have this workshop done. So it was really important, and I know my time is not too much, so I'm waiting for your question after the other participant. Thank you.
Thanks, Jude. I'm going to hand over to Grace now. Grace, over to you.
Okay. Good afternoon, everybody from Nigeria. My name is Grace Oguntade. I am the Communications and Learning Specialist for Mexico, Nigeria. So Mexico, Nigeria is currently doing a multi-sectoral humanitarian response in Nigeria, where we're addressing all sorts of needs, wash, food security, youth livelihood, agriculture, and peace building and governance. When the pandemic started, we tried to adapt several of our interventions to also provide support in terms of the COVID-19 response. And when the vaccination campaign started all over the world, we noticed a very high level of government mistrust and a lot of hesitancy in the community in terms of accepting the vaccine and going ahead to receive the vaccine. So we thought it would be very good to pilot this social behavioral change initiative in some key states to see how we could address some of the concerns in several of our states where we're implementing. Next slide. So just to give a brief context to the issues we have in the country, we already have a very big humanitarian issue from the insurgency, from the insecurity issues in the country. We have a lot of high level of banditry and a lot of violence situation in the northeast and north central states. And then for the south and the southwest states, Nigeria already has very high level of youth unemployment. We have a struggling healthcare system where there's a lot of public health issues in the country.
Seems like we've lost Grace.
Hello?
There she is.
I think she's back.
Yeah, you're back, Grace. All good.
Okay, can you hear me now?
We can hear you, Grace.
Okay, so when the pandemic started and spread to Nigeria, the concerns were, why was the government focusing so much on COVID-19, where we have a lot of national issues that needed addressing? Looking at what Mexico and Nigeria was already doing in some key states, we decided to leverage on some of our community structures to see how we can address some of these concerns and get more people in tune with what the government is doing in terms of the COVID-19 response. So two of the key locations we highlighted to implement this initiative is Kano and Yobe states. These two locations are in the northeast Nigeria. We currently have two programs ongoing in those two locations. One is the Community Initiative to Promote Peace program, where we're already addressing misinformation.
Grace, I think we've lost you. Hugh, can you jump in?
Yeah, sure. So it's already afternoon here in Nigeria, so I'll just say good afternoon. And like my colleague Grace has rightly mentioned, all of the scenarios she's painted, and we decided to pick two locations. One, we're implementing SIP, and I think that's the one we're implementing in Kano. While in Yobe, we got funding to do other programs like two resilience program, but also most importantly, in Yobe, we got funding for a COVID program that is funded by the European Union. So basically, it's just to address the COVID challenge, but looking at it from the impact of mostly like economic recovery. So in that scenario, it became very difficult, because we decided to pick these two locations because in Nigeria, we had the highest number of deaths during COVID.
Hello,
okay,
sorry.
Grace. Okay, Grace. Grace, can you hear me? She's gone again. Okay, so at that time we had the highest number of deaths in Yobe and Kano, even though they did not relate that. The government could not trace that back to COVID, but of course everybody in Nigeria said it was really COVID. Sometimes in a day we have death as high as almost 200, and as such, these two locations were critical. We needed to know when the government rolled out the vaccine at the national level, the hesitancy and quite the number of information that they start to bring. And of course, they attached it to religion, and then it became very political, very tribal, and it became like a national crisis as a matter of fact when it comes to the vaccine. Next slide.
Thanks, Hugh. Is Grace back on?
Grace
Not
is
yet.
not back
Okay.
on.
Hugh, if you can carry on until Grace is able to join back, that would be wonderful. Thank you so much.
Yeah. So most importantly, for us, we seized this opportunity to support this program because we felt it is very critical. For instance, in Yobe State where we are, the government is already doing some part of the work to see how they can be able to sensitize the communities, but most importantly, to disabuse them from vaccine-related hesitancy and, of course, disassociation and, in most instances, mistrust that is currently going on in the state. At one time, the government actually brought in over 20,000 vaccines, but they could not administer them. Very low turnout, and most of the vaccines actually got bad. And this is taxpayers' money, and it becomes a worrying concern for the government, especially in Yobe. Grace is back. Will you be able to continue from there, Grace? Or you? Hi, Grace.
Okay,
can you hear me?
Yeah, I can hear you.
All right. Go ahead, Grace.
So, what stage are you on? I'm so sorry. My internet keeps tripping me up. I don't know why.
Yeah, it's
okay. So
we're already at the slide you're seeing. You can start from the stages that we took.
Okay, so the process for us, before we started, we had to do a quick DEX review and analysis on, what resources and tools do we have on COVID-19? What is the government already doing in terms of risk communication and community engagement? To see what we needed to do to train our teams and to also train the key government stakeholders and community people who would be going ahead to deliver on this sensitization process. So we had a lot of trainings on evidence-based social behavioral change and infodemic management trainings. We had a team of people from WHO, from UNICEF, received training from a couple of health experts who were already doing something on social behavioral change communication. And so this was to equip us with the right knowledge, the right tools, and what we needed to do immediately, because it was important for us to churn out a couple of interventions as soon as we can. So following the prep, we had an assessment. We conducted a community survey in the 2 states that we selected at key locations, key local government areas where they had large populations, where we have a lot of concerns on COVID. The survey, we asked a lot of questions from community members, key influencers, and people, healthcare workers, and people who we felt needed information, who needed correct information on COVID. So following the survey, we also did like an assessment, feedback to national and state government stakeholders who we were already in conversation with regarding our plans for this community initiative. So after the feedback with the national stakeholders, they guided us and educated us on the process that we needed to follow in order to implement this sort of community intervention. And then we had a validation meeting with the key state level ministries and government stakeholders who were involved in health promotion, who were involved in doing all sorts of community engagement, to see how we can share the survey findings and what the people were saying about COVID-19 and the vaccines, what were their concerns, what kind of information they needed. For Yobe State, one of the things that stood out was that very few people had been vaccinated, but a lot of people, more than 80% of the people that we interviewed for the survey wanted to know more about the vaccines, wanted to get vaccinated, but they didn't know where to go to get vaccinated. They didn't know, they didn't have all the information regarding registration, what kind of tools would they need, what kind of paper, what kind of, what were the process for them to get vaccinated. So it was important for the government stakeholders to be aware of this so that they could address most of these key concerns. At the validation meeting, it was very interesting that this was co-facilitated by the Honorable Commissioner for Health in Yobe State, Dr. Mohamed Lawan. He was impressed with the findings from the survey, and he was looking forward to, utilizing some of the recommendations that we had from that survey. Remember, I mentioned, I don't know if Hugh mentioned this earlier, or if I had mentioned this, one of the key findings that stood out from the survey we did was that a lot of people felt that they would trust community leaders and religious leaders to provide them with the right information on COVID. But yet we had a lot of those group of people spreading misinformation about COVID-19. So how do we educate these people? How do we make them understand the impact of their influence and then provide them with the right resources to be able to provide these community people who already trust them to provide them with the right information. So if we reflect on this, we would realize that because of their large influence, because of their, because of the influence they have, it's been very easy for misinformation to spread so widely in Nigeria. For a population that is very active on social media, on Facebook and WhatsApp, we have several broadcast messages flying around. This was really worse last year about COVID, about conspiracies, about all kinds of theories, and the things, influencing the government's decision to focus so much on COVID-19. So we highlighted these challenges, we highlighted these concerns during the validation meeting. And the government stakeholders who were there were also in tune with these findings, and they were like, okay, fine, we would identify key community leaders and religious leaders that you can train and provide with the right information so that they can go ahead and spread correct information to the people, since they are already part of the people spreading the misinformation. So it was a very good approach to use the same channel, to address the same channel that are spreading misinformation, to use those same.
And yes, it was actually like a very good channel, a very good piece that we used. It was community-led. The interesting part is that it became almost difficult when people are spreading wrong rumors and saying that even if you take the vaccine, it will take you 2 years before you die. So that becomes much more difficult when people are saying not now, after 2 years. So it became very extremely difficult for people to really want to take the vaccine. And this community-led, targeting the right people at the community and targeting the right stakeholders that would disseminate this information became very critical. And during the training, during our engagement with them, they were so very enthusiastic. They asked quite a number of questions as to how are they going to do it. We created a WhatsApp group for them. They come up with, they talk about even small engagement, from probably talking to 3, 4, 5 people to planning to speak to a larger group like 10, 20, 15, and 30. And they kept sending messages saying, can you share information with us? Can you share more materials that could make it a lot easier for us to be able to engage and communicate? And it was a lot easier. One, we targeted the right people. And that's one of the learnings from here, to really target champions who really want to take this forward. Secondly, one of the most important learning we got from here is that you need to work with the right stakeholder. And in our case, we actually worked with the Ministry of Health. We got their buy-in and they saw us as collaborators. They have a challenge at hand. We came in at the right time. We provided the required support to them, and they feel they will make tremendous success because they've already received over 57,000 Moderna vaccines, and they do not really know how to communicate to the communities. They don't know, they have a strategy, it isn't really working well. But then the recommendation came that religious leaders, key strategic people from the traditional leadership, if we could do that, and we're able to do that. Hopefully, we're hoping that they've started work now, and we have just started sharing materials for them to get to work. They are so very enthusiastic. They are always communicating, asking for how can they go about it. I'm currently in Yobe. I've been able to see 2 or 3 of these stakeholders trying to organize meetings at their own level. For instance, in Yobe, like the emir of Damatru, the council sent a representative, and from that council, they can reach every corner of Yobe State. And so he's already provided that information to the Emir Council, and he's already gotten support once he receives the material to disseminate using local leaders. So for us, this is a huge success. And this is only because we're able to share learning with the group, with the stakeholders. And this is only made possible because we're able to also share our survey details and findings with them. And they kind of really, really liked it. And that really motivated them to move forward. So for them, they didn't have the skills and the technicalities to engage. And we were able to support them on how to engage, how to support, and how to disseminate to be able to clear any hesitancy and first of all, get themselves vaccinated. So yeah, I don't know.
Thank you,
next
Hugh.
slide.
Yeah, that's great. I think
these
are just, yeah, sure. These are just some of the materials that Hugh was mentioning.
Exactly.
We'll be able to share a link to some of these in the chat after the presentation. These are just a couple of other things. The IRA, Africa Infodemic Response Alliance, produces a social media listening report on a weekly basis. And so we've been leveraging that resource, as well as sharing Africa viral facts videos. So I think at this time, I'm going to hand over to Mohammed. But Grace, do you have any final thoughts before we hand over to Mohammed? And thanks, Hugh, for jumping in.
Yeah, so just a quick final point. So one of the key things that stood out is using the use of role models. The community leaders and religious leaders and political leaders are some of the key influencers of misinformation. So it was very important for us to educate them, ensure that they become role models for spreading correct information, and then getting vaccinated early so people can see them and refer to them as good sources of influences for the COVID-19 response. Yeah, so that's it for me. We can address more questions during the Q&A section.
Thank you, Grace. Over to you, Mohammed.
Thank you so much, my colleague. Good morning, good afternoon, everyone, based on your time zone. This is Mohammed Ismail. I am Senior Program Manager for Social Cohesion and Conflict Management Programs in Iraq. I'm working for Governorate in Iraq to support social cohesion programs. One of these projects I'm supporting, this is a social change behavior project. This is one of most interested project because I saw the synergy between social cohesion and conflict management approach that using in Iraq and social change behavior approach we designed this project. I will take you to talk about the context, a little about context in Iraq. This project working in Ninawa. Ninawa, one of highest percentage of vulnerable individual in Iraq. Especially when federal government decided to close the camp, that's causing to the secondary displacement inside Governorate, and that's increased the vulnerability and community needs at the same time. We are decided to target 3 locations in Ninawa, Governorate. It's Mosul City, East Bank, because this is highest number population for the cities around Ninawa. And also we are targeting Old City, Mosul, because this is most affected during the liberation process from ISIS. And lastly, we are target the Tel Kef because this is the home of the minority in Ninawa. The target population is out of camp IDPs and returnees, as well as host community and /stayees, people who stay under ISIS when they are targeted, when they are controlled for that. I will go now to the design process and preparation process. This project, one of the unique project in the design process, because that's project designed and tailored based on the or according to the evidence-based social change behavior and infodemic management for the data. That's project started for collecting data and survey, and that's a lot of information came at that time. And this is one of the most important thing for designing and tailoring this project. And this is not only that lead to the design this unique project, but the reviewing and analyzing these data from the quantitative and the qualitative. At the beginning, this is one funny thing. When started, Nicole asked us about diving more for this qualitative data. I saw what she would like to do for this, a lot of data. But then we received the analysis about the persona and people. That's so amazing for us. That's led us to next step for actor mappings, to see key stakeholders actor mapping to identify who actors working. That will lead us to do some of the coordination and high level coordination with the Directorate of Health, especially the department responsible for the vaccine. That's coordination to identify their priorities and goal, and to align our project with their goals and the priorities that will added value later to the implementation phase of the project. Then during this preparation step and the design phase of the project, we conduct a training of trainer by Nicole for the implementing team. This training focus on technical COVID-19 and COVID-19 vaccine aspects, as well as about the humans central design process. This is two things the training of trainers for the implementing team was focusing, supported us to the go to the setup and the planning phase to design project community-led approach to community engagement and vaccine equity in Iraq. Now I will go to next slide to dive about how we engage community in the process of the design. As I mentioned, we in this step also we enhance the community role and community community play a good role for the design and project. Started from the intensive workshop that conducted by the implementing team for 28 committee members around many of topics. Started from advocacy technique to give them some skills to start linking with the government and leading this a joint dialogue session with the government. Go to the social cohesion aspect. Some of that topics we trained them also COVID-19 and vaccine, as well as community countering this and this misinformation. This is aspects also we are targeting through our capacity building training. That's led to the design hyper-focused this project on community engagement strategy, because these training give the community space to design that activity I will mention later. Also, they are given space to develop a content-specific, context-specific content responsive message in between bracket, depending on WHO technical information and as well as the community feedback. Then we'll go to the implementation phase. About the implementation, we have 4 interventions. The first one and the most important one is vaccine equity. This and part of advocacy campaign to led by the community and with the government about administrative issues, and this session led at the community level. Then we raised to the government. I will talk about that later. Second one, community session about this and misinformation. We are tracking and identifying this at the community level, as well as we working to monitor social media platform after we did an exercise to identify which is the most important platforms on the social media in this targeted area. Lastly, we are working for at the household level door-to-door campaign led by our community health promoter. I will talk more little in the next slide about our implementation approach, how that's our implementation approach take place. The first one about the vaccine equity and how these communities start to identifying which the most difficult was the issues and barriers that affected community to access to vaccine and increase their confidence about vaccine. And we are they reflected what they gained from the capacity building by raising their voice and go to the government and start to facilitate a dialogue session with government about some of the topics that we already through this short period of the implementation for this project, we get some of the commitment from government, some of the access issue to vaccine, lack of the vaccine in some of the centers, also, and other lack of services. In one of the successful on that, we government try to see why community they have limited take the vaccine in one of and they are provided one of type of vaccine visor in some of the centers that increase the community willingness to take a vaccine, as well as some of the centers were open. Second, I will go to the community level in the next slide. This is a session led by our community leaders and on rotated weekly basis. They meet with other community members. They for the discussion about COVID-19 and COVID-19 vaccine, which and disinformation around that, and they are tracking these information, as well as we are in the same time, in parallel, we are monitoring and tracking the social media and see what they are disseminating in this social media around this information for the COVID-19 and vaccine. Put all of them together, what are coming from the offline session and online session, and give it to the professional person, to the community health workers, to do door-to-door campaign and try to address the community concern, community questions about vaccine. And now we are disseminating this message based on the community perception, what the community see, and we are developing this message as a community and disseminating by this amazing team. They are did door-to-door campaign. They interacted with the community because we trained them about some of skill related to the interest-based negotiation, how to lead a small mediation, and some of the discussion, open discussion with the household to change their to increase the vaccine confidence. That's what we are implementing as an Iraqi team, and we get a lot of results that we already through short period of that project, but we learn because we are work with the community and we learn from them, and we give them the first seed from the design, from the survey design implementation. We are together with the community, and that's a unique approach for our project in Iraq. Thank you so much.
Thank you, Mohammed. Great work, everyone, and just really hats off to everybody in the field doing this wonderful work. Over to you, Ramona.
So much. Thank you, Nicole, and thanks to the team, especially also for the great teamwork with jumping in for each other with connection issues here. And just to say also that we received a lot of amazing comments from the audience complimenting the work and saying how impressed they are with what you're doing. So I just want to give this to the presenters back here already. We've received a couple of questions, and so in view of time, I'd just like you to be very concise and as short as possible when answering. I know it's very interesting, it's hard, but we don't have all the time we need. But let's start right away. And so there is a question that was directed to you and Grace, so to the Nigeria country team. And that was, how can you ensure that you can find and engage the trusted people you want to work with without interference from the government, for example, or other influencers? So over to the Nigeria team for an answer.
So let me just quickly state here that the Nigerian government is very actively coordinating the COVID-19 response. And then it will be out of the question to go ahead to engage religious leaders and influencers without the government being informed. Because at the end of the day, people would still need to get the vaccines from government facilities, and also get all those resources from the government agencies in charge of the COVID-19 response. I think I did respond to the person that it's always very good to inform the government of whatever intervention you're doing and let them be informed about who and who it is you're engaging with for whatever intervention or initiative that you want to do.
Thank you, Grace. So taking away here, it's important to work with the government and to make sure that we're supporting each other. Another question that was posed to Jude is, what were the issues, the myths, and some of the misinformation that was coming from the communities when you first started your process, and especially in relation to vaccines here? Jude, over to you.
Yeah, great. Exactly. We have a lot of, especially for the misinformation, because we didn't have a campaign for vaccination in Haiti when we start our workshop. And we have a lot of misinformation. Even for the government, they didn't say nothing. And when we don't say nothing, we have a lot of bad information come in the community. So we address that to know the perception from the community before. And we come with the right information and we prove it's the right information. And when we don't know also, we have to be honest to say we don't know. We don't know because it's a evolutive, in a progress situation. Maybe in 2 weeks, I remember one question people asked to us in the past. It's about the pregnant women. If they are able to take the vaccine or not. We didn't have this information when we made the training, and we have to be honest in the training, in the workshop. And we have a lot of information we didn't know. We say, okay, we didn't know this information, but we give the good information, and we say also the way they have to have the good information. And because it was some leaders, they hear a lot of things from radio, from WhatsApp, from Facebook, from Twitter. So we gave them the right way. For example, Minister of Health, the international organization, they give us exactly the good way to have good information.
Thank you so much, Jude. We had a few questions relating on how you measure the impact of your activities, and then I'll hand that over to Nicole to either answer or direct it to the right person. And so people are specifically interested in how you track the impact within each of the countries, but then also at the more global level, bringing the experiences together.
Thanks for that question. So we were able to track and understand, of course, the reach, for example, in the Puerto Rico team. We measured as well the community leaders, information, knowledge, perceptions, ability to answer information. We also were able to understand how the information spread beyond just Puerto Rico. We understood as well from Jude and his work in Haiti, their response, not only in community, but also within that community leader approach. For example, in Iraq, Mohammed is able to track as well the number of people that are registering for vaccination through a database where they're evaluating how many people are then getting directed to the Directorate of Health to actually register and then get vaccinated. And Grace, over to you if you have any comments on how you plan to, we're still in implementation for some of these. So if you have any comments or thoughts, or Gabriel from our monitoring and evaluation team, if you have any thoughts on what the plan is to do for monitoring and evaluation.
Yeah, so one of the key things we are considering is the number of people vaccinated versus the number of vaccines, number of vaccines they have in the States. And then we're also looking at measuring the number of people who get access to information from the community and religious leaders that we have trained. And then the general positive sentiments in increase in information dissemination around COVID-19 and the vaccination campaign. But I think Gabriel will be able to answer more on that as our monitor and evaluation focal point.
Okay, yeah, so I think you've said most of it. These are one of the key things that we're going to be looking at. So it's where the community, the level the community was before we started engaging them. So we already have a lot of data that have been collected from the community in terms of their perceptions. And then we're going to still going, and we're going to use that as our baseline. So we are going to also go back to ask similar questions to get their response, and then we'll be able to measure it between the response that we got at the beginning when we first engaged them, and then we're going to also see what they are going to be saying. So we want to see if there's increase in trust by mostly the women. You understand? We want to see what they think about the misinformation. Okay, we're going to ask them questions to see if they are willing to take the vaccine, if more people are willing to take the vaccines, if they want to also see their trust in government. Then we're also going to see if we have a lot of conspiracy theory that is going on. So we want to see if truly they will continue believing in those theories, if or if they have good understanding now and they will be able to counter some of those things. Then one of the key things that I want to also take is during data collection, one of the key things that we notice, the reason why we really want to focus more on both the leaders, the community leader and the religious leaders, is that I would say over 90% of Nigerians believe in their religious leaders. They believe in their faith. So, and they tie most of these things to their faith in the sense that I don't need the vaccine because my faith is going to save me. Once I contact it, I'll be free. And so these things are tied to it. So they look up to their leaders to also certify most of these things to say, yes, that's true. Okay, so but if you can get the leaders to tell them, yes, believe in your faith, but also the part that you have to do the work, that is, you need to take the vaccine also, so that you be a role model to others, to your kids, to your brothers and others. So this is the reason why we need to bring them into it, because I believe that once the leaders, the community leaders have this, champion this, even in the churches, in the mosques, and say, okay, go out, prevent yourself and all that, it will increase the number of people that will take the vaccine. Thank you.
Thank you, Gabriel. There was one last question, I think, Ramona, that came before the actual presentation, and that was about what happens when you reach saturation point as far as reaching people. And our team in Puerto Rico has been addressing that, particularly around designing a youth summit. Would there be just about 30 seconds to just mention that briefly?
Yes, we have about 30 seconds left and then we'll need to close.
Okay, Dennis, over to you from Puerto Rico Public Health Trust, one of our partners who is spearheading this initiative. Do you mind just sharing a bit?
Good morning to all. Well, in Puerto Rico, there has been 3 phases in the vaccination process. The first one is the mass vaccination, where everyone that wanted to be vaccinated went and got the vaccine. Then there was a second part that was, well, we are not reaching the communities, the remote communities, the marginalized communities, so we have to go in and find them, right? And that was the second phase. And then there was a third phase that once we are already in the community, what happens when there are some people that do not want to get vaccinated? So in that moment, you reach a wall, right? In the numbers of vaccination of people that are getting vaccinated. So that's when the data that we have been obtaining from the program, in the rumor tracker program, led us to go to the community leaders and having them establish a relationship with the people that were unvaccinated, because they have that relationship, they have that trust from the community. So the agencies or the nonprofit organization, we don't have that trust. We depend on the community leaders to establish that relationship. And it's an issue of community mobilization. You have to educate that people, but from a sense of trust. And because obviously the information, the mass information that the government or the agencies or the nonprofit organizations are producing is not working with that type of person that is totally against the vaccine. And it's normal because that person has a wall of misinformation in front of them. So that's where human relationships set in, and community leaders can address that person with a sense of trust that doesn't have anything to do with vaccination. It has to do with life, with everyday life in the community. So what we did was getting all the information we could to that community leader so they can go directly to their community and start establishing those, not the relationship, but the information in their relationship with their communities. And especially with youth, that has been the case in Puerto Rico because there's a sense of apathy with youth. That they think that vaccination and the COVID-19 pandemic doesn't have to do anything with them because they are not going to die. They don't have to do nothing about it. So they're not against the vaccine. They're not spreading bad rumors. They just feel apathy about it. So that's where the relationship with the community leaders is important, because if we can mobilize the community around that topic and make it important to them, that's when we achieve. Right now in Puerto Rico, the numbers of youth people that are getting vaccinated are rising, because there has been more of a focus on establishing those relationships and educating those youth leaders around the topic of vaccination, and making it an important thing for their community, also for their social group. Thank you.
Thank you, Dennis. Thanks so much. Just as one last question that's come up several times is people were asking whether you could share some of your materials, and just to let everyone know that Nicole has kindly posted some links into the chat so you can access some specific resources, for example, from the Puerto Rico program, but also the more general community-based facilitation tools and trainings. Thank you so much for this, Nicole. And I hope everyone on the webinar, there's some more coming, will make use of those resources and have a greater look at the fantastic work that the teams have been doing at their different country levels. So with this, unfortunately, we already have to close because we're quite a bit over time. I'd like to thank you all for your fantastic contributions, for your wonderful work. And I feel there's a great need to continue this discussion, and people were very interested. So maybe we can see if we could organize for a second webinar at some point and go into more detail of some of the questions that have been raised, if that sounds agreeable to you. Any last words for Nicole here? Would you like to close for your team?
Oh, I'd just really like to thank everybody for their hard work. And, you know, for those of us that are on the call right now, really great leadership, an incredible job. And then also just to acknowledge and thank everybody else who is behind the scenes doing this work. A shout out to all of our collaborating partners in Puerto Rico, our team in Nigeria, who has been participating in this from the beginning. Mohammed's team with Omar and Ayman, who are in the field, you know, with Jude and Andy and everybody, and Darlene, who's on the call, who really helped to spearhead a lot of this information in Puerto Rico. Really just thank you to everyone for your hard work.
Thank you so much. So thanks again to the panelists. Thank you so much to the participants for submitting the questions and being with us for this webinar today. You will find a recording of this webinar on the WHO EPI-WIN website, as well as on the WHO EPI-WIN YouTube channel, so you can access the recording. And we all hope to stay in touch, and I wish you a wonderful rest of the day or beginning of the day or night, wherever you are. Bye-bye, everyone. Thank you so much.
Thanks, guys.
Thanks, everyone.
Thank you.